Hey everybody, I have read your quizzes and graded your essays. The 5 multiple choice questions were exactly that, multiple choice, and they were graded by the embedded test bank software. So you've already been given the results of those. The 2 essay questions that were specific to informed consent required you to write a brief essay and explore concepts that were relevant to the questions asked. The question that asked about what should be discussed before a patient is asked to sign a consent form, the vast majority of you got the obvious ones. The extent of the procedure, the likely outcome of that procedure, the possible risks, the benign all the way to the serious, including death. A few of the other ones that were covered by your readings this week included the skill and competence of the physician or the healthcare provider doing the intervention. And the Affordable Care Act in 2010 added the requirement that the cost of the out-of-pocket expenses for the client be explored. That is something that is done in a variety of ways in different systems, but it is a caveat that's out there. The big ones were the extent of the procedure, procedural outcomes, possible risks, and then one thing that a few of you missed was the need to affirm that the consent was voluntary. Sometimes we think that that's implied, that if you're not as a provider in the environment to coerce the client, that they are going to voluntarily sign a consent just because you've asked and they understand that it's voluntary. I want to encourage you to be thinking about a vulnerable population set that may feel coerced, whether intended or not. Sometimes a healthcare provider has implied power because they are in control of an individual's healthcare. That can present a sense of coercion that because the physician says I should do this, therefore I should do this. The other thing is sometimes there's underlying family coercion that's occurring. Perhaps you have someone that's critically ill and really doesn't want to undergo a procedure and is ready for palliative care, but there are family members who are in the room who really are pressuring that individual to have a procedure that they don't really want. That could be from a family systems issue. It could also be a cultural issue where there is a patriarch or a matriarch in the family that makes those kinds of decisions, and that individual isn't automatically assumed to be in control of their healthcare decisions. It is so important that the healthcare provider that is seeking the informed consent covers all the logistics, but also makes it very clear that the patient has every right to decline to consent, and that at any point that consent can be withdrawn. They can change their mind. And we want to be sure that that's an actual conversation that's occurring, that we affirm the voluntary and the rescindable nature of that informed consent. So I do want you to be thinking about that. Your other question is, in what circumstance may a physician proceed in the absence of a consent? The vast majority of you did a really nice job talking about the emergency circumstances when a patient could not offer voluntary consent and that consent was therefore implied. Another one that was a big one that we needed to talk about was therapeutic privilege, and that is when a provider really reasonably believes that disclosure could be a serious consequence or have a negative impact on the well-being of the patient. And normally we think about someone who's in a fragile state for a variety of reasons. Either they've recently suffered a traumatic loss, there may be a background mental health issue that doesn't question their competence, but questions their stability. So we want to be very thoughtful about what therapeutic privilege looks like. It's not something that many healthcare providers want to venture into because it's kind of a slippery slope. How does an individual provider determine whether someone is capable of emotionally handling distressing information, and that can be pretty complex. 2 other minor ones that were mentioned but not as critical was common knowledge as well as prior knowledge. They've already had the procedure, so they should know. And then common knowledge, things that are routinely understood by a common understanding. So that feedback was provided to you in the quiz. Something I want you to take away, the vast majority of you are in an allied health position in some fashion within a healthcare system. It is so important to remember that the sole purpose, and the sole provider who has responsibility for getting the informed consent is the healthcare practitioner performing the procedure. If you are a nurse or a respiratory therapist or a physical therapist, whatever your role is, it is not your responsibility to take that consent into the patient's room, ask them to sign it, or explain procedures. The only responsibility of nurses is that they witness the signature. That's it. And I know just from personal experience that I have seen that process not be followed. I have seen people go in to get consent that they should not be the person getting consent. So you want to protect your license and your certification, and be sure that you're always operating within the scope of practice for which you have credentials for. Again, the consent is always done by the provider who is performing the procedure. So I want you to be very mindful of that. Next week, you have your first case study review to do, and it's important that you take time to read and to study the Carell versus the Commonwealth of Virginia decision that came through the Supreme Court. It's an important decision. It's also something I read it I actually think 3 times. And I took some notes because it was not something I was familiar with until I taught the course. So it's interesting from an outside perspective to kind of play Monday morning quarterbacking of what you would do in that situation or what your thoughts about that situation are. So I do want you to spend some time thinking about what were the actual events in the case, how were they presented, what objective information do you have, and then I want you to deal with that first, because your prompt says to summarize the pertinent facts of the case. Please do not rewrite the entire case. Give that bird's overview, and then to discuss and analyze the decision of the court. What decision did the court make, and what supporting rationale, data from evidence did they use to make that decision? That's the objective piece of this. That's what was in the case review that you are reading. And then your question 3 says, do you agree or disagree? That's the subjective nature. That's the squishy stuff. That's the part where you get to say, this is what I think. But first and foremost, I want you to deal with the nuts and bolts, with the objective data that is presented in this case that was resolved by the Supreme Court. It is important that you take the time to really read this, take your own notes so you understand it, and you can present that the detail in a pretty concise manner. Remember, this is a discussion board. This is not a formal paper, so you don't need your title page information. You don't need all those extra line spacings. What you do need to do is appropriately cite your sources and make sure that you're including references. And this assignment requires 2 scholarly references to be included, as well as biblical integration. So you want to be sure that before you start writing this, that you're thoughtful about what's the evidence, what do I know about it, and how can I support it with 2 scholarly sources? And then what is the biblical integration of this? What can I learn from my Christian? What can I apply from my Christian worldview, from my knowledge, that helps give context and perspective to this information? And I want to caution you that when we talk about biblical integration, we're not talking about dropping in a verse at the tag end of a paragraph and keeping moving. That's not biblical integration. That's citing or placing a verse in a paragraph. Biblical integration is explaining what God's word tells us, and then give it context and meaning. Tell me, why is what you have used from God's word relevant to this specific topic? So be very thoughtful. And that's not just a 501 thing. That's as you go through all of your courses here with Liberty University, the concept of biblical integration is more than just tagging a verse and moving on. You have to be able to first understand God's word, put it in appropriate context, and then give it a relationship to what you've written about, and help us understand why you've included it there and how it has context from a biblical standpoint. All of that to be done in at least 500 words. If you are creeping towards 1,000, you are way too many words. So begin to write this and then craft it and work concisely to answer what is being asked, but do so in a concise manner that is well supported. The transition from a creative writing style to a scientific writing style can be a little tedious. And normally when I see discussion boards that wander into the 1,000-word space, it's because you are writing all these things that don't need to be written, and you're adding words that don't need to be expressed. Think about, what do I know? What do I need to write? And how can I do that in a concise and professional manner? That's really the scientific reasoning, the scientific writing skill of being able to address what's being asked in a concise and meaningful way. without a lot of adjectives and adverbs. It is not a skill. It took me years and years to fine tune it, and even now I find myself struggling with it. So just be very mindful that your case study reviews and any discussion board need to be written in a scientific manner that address the questions you're being asked, and do so in a supported and scholarly manner. I think those are all of my notes. You guys are doing a great job. We are in the middle of week 4, which is fantastic. We're almost at the halfway point. Let me know how you are. Remember to use the Ask the Professor discussion board. That's great for the who, what, where, when, why, how kind of logistics questions. Anything personal related to your grade or your own experience, send that to me by email, and then we'll address those concerns as we move forward. I hope you guys are having a great week. Be in touch with any questions. Take care.